Before we get into the main objective of this video, let us first recall what is a first aid. First aid is the provision of initial, immediate, and on-the-spot treatment to victim of an accident or sudden illness. It is usually performed by a non-expert person to a patient until full medical treatment is available. It mainly aims to preserve life, prevent further harm, promote recovery, pain relief, and protect the unconscious. Some of the most common medical emergencies that require first aid are heart attack, stroke, burn, bleeding, and poisoning, but for today, we're going to focus on burns. Burn is a tissue damage that results from scalding, overexposure to the sun or other radiation, contact with flames, chemicals or electricity, or smoke inhalation. The amount of damage that it can cause depends upon the type of burn, its location, its depth, and how much body surface area that it involves. Speaking of type of burn, burns are classified based upon their depth. We have the first degree burn, second degree burn, and the third degree burn.
For minor burns like first and second degree burns, this is treatable at home, while others needed a medical care immediately. First degree burns, or also called as superficial burns, are very common. It only affects the outer layer of the skin. It takes 3 days to 1 week for the burn to heal itself. Sunburn is also considered as a first degree burn. If you have a first degree burn, your skin may be red, painful, and have swelling. The pain and swelling may be mild, and your skin may start to peel after a day or so. When treating a first degree minor burn, immediately hold the burned area under cool running water for at least 10 to 15 minutes to reduce the pain and swelling. And then, gently tap it with a clean dry towel or cloth. Remember that avoid rubbing the towel aggressively across the burn. Do not use ice or extremely cold water and avoid applying butter or oil to the burn, for this might cause an infection and worsen the burn. If you are wearing any jewelry or other tight items near the burned area, gently remove them quickly before the area swells. Use moisturizer, aloe vera lotion, or burn gel to help soothe the burn and speed up repair of the damaged skin. Second degree burns or partial thickness burns are more severe than first degree burns. They affect the outer layer and the second layer of the skin. It takes longer than 3 weeks for the burn to heal, and it might leave a scar. Second degree burns are more painful, and blisters start to appear when the burn cools down for a while due to an increased depth of burn wound. For the treatment of second degree burns, follow the instructions for first degree burns. If blisters form, do not pop any blisters or use needle to prick it to avoid any infections. Let them heal on their own while keeping the area covered. If the blisters pop on its own, gently clean the area with mild soap and water. Apply an antibiotic ointment and then cover your burn with sterile, non-stick gauze pad to protect the area, prevent infection, and help the skin to recover. If you have pain, take an over-the-counter pain reliever such as ibuprofen or naproxen. Be sure to read the label for the correct dosage. The basic first aid is for minor burns. If the burn is larger or you experience severe symptoms, immediately call the emergency services and seek immediate medical care.
The next and final one will be major burns. These cases are recognized as third-degree burns. Do you think there's more higher degree worse than a third-degree major burns? Listen carefully then. A third-degree burns destroy all the tissue of the epidermis and dermis, and they extend into the fatty tissue below. In other words, all the layers of the skin is involved in this particular serious scenario. According to our research, these burns might not hurt because it often deactivates pain-sensing nerves in the lower layers of skin, but it is always necessary to seek emergency care. Okay, how we will determine if it is third degree burns or higher? Let's direct it to the point where it will look dark, red, dry, white, and leathery. You will easily be able to see that the burn penetrates deeply into the skin, and you may even see yellowish fatty tissue if it is larger than 3-inch diameter on the wound area. The deeper the damage extends, the higher the burn degree is. 4th degree burns penetrate through fat. 5th degree burns reach through the muscle, and 6th degree burns extend to the bone. An important reminder for everyone first that if an infant or elderly person experiences a burn of any degree should seek medical attention right away. Let's now proceed to how to treat major degrees and apply first aid awareness and skill. First and foremost step in treating major burn is to call 911 or seek emergency medical care. Further action must take until the emergency arrives, including get the person away from the cause of the burn. If the cause was something electrical, make sure the power is off before getting close to them. Check to see if the person is breathing. Check to see if the person is breathing. Check to see if the person is breathing. If not, start rescue breathing right ahead. Remove clothing from burn areas, but don't try to remove that stuck to the skin. Take off anything that might keep them from moving freely or easily, like jewelry or a belt. Once the victim is in a safe place, keep the person warm and still. Try to keep the injured areas in a clean. Try to wrap the injured areas in a clean sheet. Do not use cold water on the victim. Do not use cold water on the victim. This may drop the body temperature and cause hypothermia. In terms of chemical burns related, remove the chemical from contact with the victim and identify the chemical that was involved. Keep a close eye out for signs of shock like fainting, dizziness, pale skin, and shallow breathing. If you notice any of this, try raising their feet and legs a bit, but don't move them. If they start to throw up, turn them on their side. And always remember, seek emergency medical treatment in your local hospitals immediately for any burn you suspect to be a 3rd degree type or higher.
It is important to be alarmed indoor and outdoors. Blocking areas where cooking, baking, and heating were being held would increase the safety not only for those who do these chores, but also for children who are prone to get in these accidents. It would also help to avoid causing fire. Avoid holding 2 or more objects when bringing hot liquid or beverage, such as soup or hot water, to prevent from hot spills. Fire-resistant fabric would also help, but is optional. Keep appliances unplugged after using. Do not put heaters to 120 Fahrenheit or more. Encourage family to know and learn about fire and burn precautions to keep away from accidents.